On the streets of New Orleans, messages of support for those on the front lines of the coronavirus. Medical staff barely have time to read the signs. The city is dealing with one of the worst outbreaks of the virus in the US.
Most of the rooms will have medical cots.
The strain on local hospitals is so acute, a convention center will take in those with less severe symptoms.
It tends to be what we call supportive care. And it's things like oxygen and getting out of bed and walking around and staying well hydrated. There aren't any specific medications that cure somebody of this illness.
Despite testing both in labs and at roadside locations, the virus continues to ravage the city. Death rates per capita in the New Orleans area are outpacing those of New York City. Officials say hospitals will soon be at breaking point, and so far the virus has hit one demographic particularly hard.
Slightly more than 70% of all of our deaths are among African Americans, who make up about 32% or so of the overall population of our state. So obviously this is a big disparity, and we're going to try to figure out what that is attributable to and what we can do about that as quickly as possible.
Despite warnings, some religious leaders in the state continue to hold services. Pastor Landon Spradlin, who criticized hysteria over the virus, was in New Orleans for Mardi Gras, where he preached on the streets. After spending 8 days in intensive care, he died of COVID-19. It's thought he contracted the virus in New Orleans. In a city with high rates of heart disease, obesity and diabetes, the worst is yet to come. Doctors say they're bracing for hard times in the coming days.
The hospital's been slowly filling up, and we're waiting for that point of where we hit the critical mass, and then it's going to be the next phase. We're going to have to try to figure out how to handle that issue.
Dr. LABAS and his team are doing what they can to get ready for the coming storm. The next few days may prove more challenging than anything New Orleans has faced before. Andy Gallacher, Al Jazeera.